Good evening, everyone. Welcome. I hope everyone's tuning in for our webinar tonight, Truths and Myths About COVID-19. My name is Lisa Stein. I am the Chief Operating Officer of the Marion and Aaron Gural JCC. I know I can't see all of our participants, but I'm looking forward to meeting everybody at some point in the near future. And I know tonight's talk is a really important one and a subject that's on everybody's mind. So I'm appreciative of everyone being with us. I want to welcome and thank Rabbi Dr. Glatt, who's joining us to facilitate. And at the end, we will have time for question and answers. Before I turn it over to Rabbi Glatt, let me introduce him. Rabbi Dr. Glatt is the chair of the Department of Medicine at Mount Sinai, South Nassau. He also serves as the chief of infectious diseases and is the hospital's epidemiologist. And he is in charge of the hospital's Infectious Diseases Society of America Designated Center of Excellence in Antimicrobial Stewardship. Previously, he has held senior academic and administrative positions, including being the president and CEO and the chief medical officer at other major institutions. Rabbi Dr. Glatt is board certified in infectious diseases and internal medicine. He completed a fellowship in infectious diseases at the SUNY Health Science Center in Brooklyn and served as chief resident in internal medicine at Brookdale Hospital Medical Center. He's considered an expert in infectious diseases and a spokesperson for the Infectious Diseases Society of America. He's authored several books and journal articles that have appeared in the New England Journal of Medicine, Clinical Infectious Diseases, the Journal of the American Medical Association, and other major publications. I know that I am new to the JCC, but that Rabbi Dr. Glatt has shared his expertise with us before, and we're appreciative that you're here to share tonight again. And I will say I'm a parent myself, very interested to hear as we're starting this school year. So thank you again. And I'm honored to turn the microphone over to you, Rabbi Dr. Glatt.
Thank you so much, Ms. Stein. Can you hear me okay?
Yes.
Okay, so it's a pleasure to welcome you to our community as the new COO of the Marion and Aaron Gural JCC, which is a wonderful community institution. And we thank them and you for putting on this program tonight, which I do think is a very important program. Now, I will tell you right from the start that there are a lot of unknowns when it comes to coming back to school. And I'm going to focus on how we can make things as safe as possible. But I will stress that each and every local school has to have their own medical advisory committee, input from the parent body, and obviously if it's a yeshiva, has to have the final say from the Rosh Yeshiva, whoever is in charge of that school, after listening to the appropriate medical advice, to make their decisions as to how they wish to go back to school. And obviously it goes without saying that the local Department of Health regulations, the local Department of Education regulations when it comes to public health need to be adhered to at all times. So nothing that I say should be construed or thought of as saying, well, he disagreed with our policy in our school, or our policy is wrong because he said this or that. So again, I'll start off one more time and say that the local departments of health, they decide on the public health policies for the schools. If the state has a mask mandate, so then I'm not going to tell you that that's right or wrong. I will tell you the state has a mask mandate. That becomes the de facto practice for the state. And likewise with any other regulations, whether they be public health, whether they be educational, the only time that we would not listen to Dino de Malchus Adina, essentially to the local authorities, if they're anti-Jewish, if they're making regulations that go against Yadus, that go against Judaism. They say you're not allowed to keep kosher, so of course we don't listen to them. But when it comes to good public health, not only do we have to listen to them because of Dino de Malchus Adina, because we have to follow the law of the land, but we have to listen to them because that's the halacha. That is the requirement, Jewish law requirement for us to keep ourselves safe. Nishmartem od lenafshosechem. We have to go and protect ourselves. We have to make it safe for everybody. It's not an option. It's not a good idea. It's not, I feel like doing it, I'll do it. It's a requirement. It's an obligation. So that's where I wanted to start off. The next thing I wanted to say is that it's a very opportune time for me to have this talk because the Infectious Disease Society of America just came out yesterday with a statement on a layered strategy on how to protect students and school employees. And I think this, again, is a well thought out short statement. And I'll go over parts of it because it's a statement and it doesn't give you all the background. It doesn't tell you all the science behind it. And it doesn't tell you you must do this or you must do that. The idea of a layered strategy is something I've always advocated when it comes to how to keep schools open, how to keep schools open, how to keep all of our rituals as much as possible open in the setting of this horrific pandemic. So a layered strategy, I call it an intelligent strategy. One size fits all. Oh, everybody must mask. Everybody must do this. Everybody must do that. Rarely is scientifically correct. And it also leads to people saying, well, since it's not applicable, it's wrong for me, so therefore I'm not going to do it. Now, sometimes we don't have a choice. Unfortunately, Nebuchadnezzar was so terrible around Pesach 2 years ago that we had to close the shuls. We had to close Jewish life for a short period of time. We were davening at home by ourselves. And that was understandable. There you needed a drastic action. I hope and pray that we don't ever have to go back to that, not only for COVID, but for any illness or for any situation where we, as Rabbanim, have to tell our congregants, please stay home from shul. That goes against everything that we want to do. We want to tell people, come to shul, come to the shiurim, come to the social events that are kosher in the shul. We want, as parents of children or parents of grandchildren in school, we want to hear the yeshiva say, come to us. We're the best place for your children to learn, to grow, to be educated, and to be safe. So everything that I say has to be understood with, it will depend greatly on what happens around us in terms of how we open up our schools. So this layered strategy, intelligent policies are made to protect our holy students, our children, our grandchildren. For some of us, our great-grandchildren. I hope to be there at that stage at some point. And we really, really want to make sure that we're doing everything to not only maintain the spiritual health of our children, which is why we send them to a yeshiva, but we also want to make sure that we maintain the physical health of our children. And I don't think those two are contradictory to each other. And I have always been at the forefront of not closing the yeshivas. And we only recommended that for a very short period of time. I think the yeshivas, the schools are the lifeblood of our future and the lifeblood of our present. We need to make sure that our children are in a safe, comforting, caring, and spiritual environment so they can grow. And therefore, this strategy is critically important to understand. And the number one part of this strategy, and they didn't put it first because it's alphabetical order, because it's not. The number one strategy is vaccination for all eligible individuals. And that sometimes gets lost in the mask or not mask discussion, which seems to be the only thing anybody ever cares about or asks about in school. And vaccination is critical. And I'll talk more about that because this talk is also entitled Truths and Myths about COVID-19. And nowhere have we seen more myths and falsehoods about COVID-19 than with regards to vaccination. There is tremendous misunderstanding, tremendous misinformation, which I'd like to correct. And that's where I'll really spend a lot of my comments on, and then I'll take questions afterwards. I plan on speaking for another 10 or 15 minutes at most, and then I'll take questions. So if you do have questions, please address them to Ms. Stein in the chat box, and we'll be happy to try to answer whatever we can answer. And again, I'll tell you right now, for some, I just don't know the answer to. We have to understand that in medicine, we've been humbled by this disease, and we have changed our opinions and advice because of new information, and that's not a bad thing. That's a good thing. If you're still giving the same advice that you gave back in Purim of 2020, then you're not going to be a very good public health official. The critical and most important factor is to vaccinate all people above the age of 12 who are entering our schools, whether they're students, whether they're faculty, whether they're the janitorial staff, whether they're the bus drivers. Anybody that's around our children, we should want to have vaccinated for the dual purpose that to protect their health and to protect our children's health. At the present time, and I don't think that's going to change for the next couple of months for certain, maybe by the end of the year, we'll have a little bit more data. But right now, children under 12 are not eligible for vaccination, and nobody should be vaccinating these children. A lot of people have asked me, well, now that it's FDA approved, can we use it off-label usage? Can we give a vaccine that's approved for 12 and up to a 10-year-old, an 11-year-old? And I strongly at this point in time say no. We shouldn't be doing that because we just don't have enough information. I've always been asked, oh, well, you're pro-vaccine or you're anti-vaccine? And I say, no, I'm pro-science. I'm not against giving everybody every vaccine that exists under the sun. I'm only in favor of giving vaccines that make sense for that particular patient. And while the COVID vaccines make great sense for 12 and up, they make no sense at this point in time for under 12 because we just don't know. And that's a critical fact to remember. Children under 12 cannot be vaccinated, so it's incumbent upon everybody else around them to protect their health, to get yourselves vaccinated. And in addition, that will also make sure that if children are carriers, and we now have data to show that children can be efficient transmitters, especially of the Delta variant. The studies suggest that the older kids in the household bring it home, and then in the household, the younger kids are the ones that spread it. So at the beginning of this pandemic, we weren't certain how much of a source of transmission younger children were. Toddlers, preschool children, grade school children, as opposed to middle school or high school children. So now we clearly know that all of them can transmit. So therefore, the best way to prevent the spread of COVID to our students, to keep the schools open, is to make sure everybody in the school, for whatever the reason, who's 12 or up is vaccinated. And I'd like to spend a little time in a moment talking about why people aren't getting vaccinated. But let me just finish off this layered strategy and explain what other methods we can do. So besides the mask question, which again, the Department of Health has issued a mandate, so it's inappropriate for me to talk about it when the Department of Health has issued a mandate on wearing a mask. So it's it's not my place to agree or disagree with the Department of Health regulation unless I think it's dangerous. And I don't think it's dangerous. One can argue, is it comfortable? No. Is it essential? One can even argue how effective these wearing of masks in a first grader are going to be. But that's not the purpose of the talk tonight, and I won't comment on that further. But what we can do, separate from wearing masks, is try to ensure some distancing where possible. In the olden days, when I went to school, we had lots of assemblies and everybody standing in line a foot away from each other. And you'd stay that way for some, decent periods of time. I think schools should be judicial in when the children all need to be together in the same place in small indoor spaces, whether they're masked or not, whether some of them are vaccinated or not. That's not a healthy situation. So trying to maintain distance where possible, especially now in the months of September and October where the weather is good, have events outdoors rather than have events indoors where possible. Maintaining, where possible, separation between the classes. Okay, so the first grade is going to be together. Why does they have to be together with the other first grade all the time, or with the second grade, or with the kindergarten kids? Try and maintain some sort of bubble system as possible. I know it's not possible all the time, and I know the children may be getting together outside school in different ways. But these are a layered strategy. Because something is dangerous doesn't mean that you should do it all the time. You try to limit when you have accepted upon yourself doing certain things that are dangerous, like driving a car. So you don't drive a car when you're tired. You don't drive a car as much when the roads are difficult because it's very snowy outside, it's very rainy outside. So you try to limit where you have to drive your car. That's the layered strategy that the Infectious Disease Society recommends. Schools should be paying attention to ventilation, appropriate filtration systems when the doors are closed, when the windows are closed. Keeping windows open, keeping doors open where you don't have great filtration systems is an excellent way to mitigate some of the risk. Leaving the windows on the school buses open, again, weather permitting, is certainly something that is a useful, no harm, nobody's upset about that. So those are things, again, in this layered strategy that I think are under talked about and underutilized sometimes. It's important for parents to realize that school is not daycare. School is supposed to be a healthy, safe environment where your children will grow and other children will grow. When you're sick, school can't be thought of as babysitting because you got to go to work. School should be safe. And if people are sick and they go to school, there's an excellent chance they're going to spread illness, whether it's COVID or whether it's the flu or whether it's RSV or whether it's some other viral illness. You're not doing anyone a favor by sending your kid to school. And especially now when people can work from home in some situations, so the children aren't going to be left alone. Yeah, it's a little bit hard to work at home when your kid is sick. I understand that. But at the same time, sending your child to school when the child is sick and getting everybody else in the class potentially sick, that's not right. It's not ehrlich. It's not moral. And it's outright dangerous. And again, I understand childcare issues. It's not a simple thing to tell a parent who's expecting to go to work that their child can't go to school because they woke up with a 102 fever. But again, safety has to trump everything else. And finally, I do think that there needs to be testing as appropriately done to identify people. The idea, well, let's not test so we don't have to know. Let's stick our heads in the ground and make believe that there's nothing dangerous outside. That's just an incorrect approach as well. So I want to briefly go through some of the myths about vaccination. Now, everybody knows, of course, that the Pfizer BioNTech vaccine was approved fully by the FDA. So one of the major arguments that people have had against vaccination is that, well, it's experimental and we don't want to use it. Well, guess what? It's no longer experimental. So therefore, I do think it's critically important that people realize that this has now undergone an extremely thorough review. It had undergone a thorough review beforehand, but we've had billions of people getting these vaccines, and it just is no longer even a thought to say, well, these are experimental vaccines that we don't have enough experience with them, and who knows what's going to happen. Well, how many people say that about almost anything else in life? There's a new food that came out. Oh, let's go and try that new restaurant, that new food. Or let's go and take this medication, which just got FDA approved because it's a great medication. I've never once had anybody say to me, well, what's going to happen 20 years from now if I take this medication right now? People trust their physicians. They trust the process. If the physician says, listen, you have a serious illness, this medication is good against this illness. It does have some side effects. It does have potential toxicity, but we recommend that you take it. We've evaluated the risks and the benefits, and we recommend that you take it. So everybody takes it. I've never once in my entire medical career had somebody say, do I know what the long-term side effects are of this brand new medication, this brand new antibiotic? Not once. So I think people have to realize that it is inconsistent, to say the least, to ask that for these vaccines when that doesn't seem to be a concern in other places. Now, I will tell you it's a legitimate question, but we also have 100 years of experience with vaccines in general. And we have known for years and years and years that the idea of long-term out there side effects occurring from vaccination are almost unheard of. It's extremely rare. And we haven't seen anything in the 6 to 8 to 10 months that we've been using these vaccines since January of 2021, even December of 2020. We haven't seen 6-month, 8-month, 10-month complications. From the studies, we haven't seen now a year's complications. So the likelihood of something cropping up 20 years from now is extremely unlikely. So these are some of the myths that are out there. Another myth about the efficacy of these vaccines. Everybody reads in the newspaper that vaccines don't work as well anymore against Delta. So again, I need to point out to people that there are hundreds of thousands of lives that have already been saved because these vaccines have been so widely used. And these vaccines work phenomenally well against the Delta variant because they prevent serious illness and they prevent intubation, they prevent ICU stays, they prevent death, and they work extremely well against the Delta variant to do that. Almost all the deaths in the United States, almost all, due to COVID now are in unvaccinated people. Almost all the CCU, ICU admissions to the hospital, the critical care unit admissions to the hospital, intensive care unit admissions to the hospital from COVID in the United States are almost entirely in the unvaccinated population. So these vaccines are phenomenally good. And that's another myth that needs to be broken, that people think that the vaccines aren't good. Yes, you do get a bunch of local side effects from these vaccines. You get soreness in the arm, you get a flu-like syndrome, you can get a headache. It goes away. They're all mild, and they almost always go away within a day or two. You do have some potential concern for serious allergic reactions. The numbers are 5 per million people will get a serious allergic reaction. And even then, those are treatable, and they're over when you treat them, and there are no long-term side effects from them, and there's essentially no death from them. And when you think about it, it's only a little bit more common than in a flu shot. And most people aren't concerned about taking the flu shot, and they have almost the same rate of allergic reaction, maybe 1 to 2 per million instead of 5 per million. People talk about the risk of myocarditis, heart inflammation. Well, not one case of a person getting this has resulted in death. And it's a small number of cases that have been reported. And people don't realize that getting the same heart inflammation is 6 times more likely in COVID. So again, people have to understand these vaccines are extremely safe. The biggest fallacy out there is regarding pregnant women, nursing women, and women who may want to become pregnant in the near future or even 10 years from now. And there's this horrible, horrible myth, total falsehood out there that these vaccines are both dangerous in pregnancy and cause infertility. And nothing could be further from the truth. This week in JAMA, one of the major medical journals, they looked at how COVID-infected pregnant women do far, far worse than the same group of women who don't have COVID that give birth. They're 6 times more likely to require admission to an intensive care unit. They're 14 times more likely to require to have a tube put down to them to breathe. And they're 15 times more likely to die. That's what happens when you don't vaccinate pregnant women. This is a terrible, terrible thing, this misinformation that it's dangerous for pregnant women. Women who have COVID have a higher likelihood of giving birth prematurely. And we have now a ton of experience with pregnancy and the safety of these vaccines. And the CDC has recently released all of this data, and they stated, and I quote, "There are no safety concerns for pregnant people who are vaccinated or for their infants." And the American College of Obstetrics and Gynecology, Society for Maternal Fetal Medicine, Society for Reproductive Medicine, and many, many other societies all actively now advocate vaccination in pregnant women. Does it cause infertility? So that's nonsense. There is not one published paper showing evidence that it causes infertility in men or women. Now, COVID can make you infertile, both men and women. It can kill you. You're pretty infertile if you're dead. But there is zero evidence that the vaccines cause infertility in men or women. And you can see this yourself. You don't have to take my word for it. Go to the CDC website and look at that question. And they write, there is no evidence that COVID-19 antibodies following vaccination or vaccine ingredients cause any problem with becoming pregnant now or in the future. If you receive the COVID vaccine, you don't have to stop trying to get pregnant. It is 1000% clear to me that we will save more Jewish lives, save more any lives, by vaccinating all of these younger women who are above the age of 12 as soon as we can. If they haven't gotten vaccinated yet, that will save lives That will allow more Jewish babies to eventually be born. And if we stick our heads in the sand and ignore this problem, and if we stick our heads in the sand and make up information that these vaccines are dangerous for women's fertility, it just is not true. That's the biggest myth I wanted to contradict for tonight. So I've said I would stop at 8:25. So I will stop at this point in time. I'd be happy to answer any questions that you might have on the chat. And I thank you again to the JCC Aaron, Marianne Gorel, and to you, Ms. Stein, for putting together tonight's program with Kathy Byrne, who's a friend and a wonderful person as well.
Rabbi, thank you so much. I think the focus of addressing the truths and the myths was so relevant and so much light on this. So I'm very thankful. And we have so many people joining us, which just goes to show how much this is on people's minds. So we do have a few questions. And I just want to, we do have a few minutes. So I just want to encourage people, if you still have questions, to put them in the Q&A box. And in the meantime, let me share, Rabbi, if you could address, someone asked a question about the booster that we're hearing about.
Okay, so I think it's a little bit of a controversial medical discussion right now, so I'll try to put it in perspective. And so this question is not a yes or no question, so it will take me a few minutes to try to give a complete answer, but it is such an important question. So the booster shot really is a misnomer. It's not the best way to define this. There are really two reasons why you would give somebody a third dose of the mRNA vaccines or a second dose of the Johnson & Johnson product. And the first reason, which is the one that the FDA has given emergency use authorization for, is for people that never mounted an immune response to their vaccine. And this is really for people that are moderately or severely immunocompromised. A person who, for example, had a solid organ transplant, they had a kidney transplant, they had a liver transplant, a heart transplant, or other similar types of serious immunocompromising medical conditions. When they were given their two shots, let's use the two shots of the mRNA vaccines, either the Moderna or the Pfizer, they never mounted a good immune response. If we had known this then, we never would have recommended that they only take 2 doses. Just like with other vaccines, for example, the hepatitis B vaccine, we recommend that you take 3 doses. Other vaccines, it's even 4 doses, because you need to give continuous immunization challenges in order to get the body to respond with a proper immune response. So what we have learned is that about 50% of those severely immunocompromised patients, which probably make up about 2, maybe 3% of the population that was vaccinated, about 50% of that small group never really had a good response to 2 doses of the mRNA vaccines. But when you give them a 3rd dose, even months later, 50% of that group will now mount a good immune response. So therefore, you're going from only 50% responding to now 75% responding, which is a tremendous benefit, because these are the sickest patients. And if they get COVID, they have a much higher morbidity and mortality. So in this group, I wouldn't call it a booster. I would call it an additional shot to gain immunity. And those people are right now fully FDA authorized through the emergency use authorization to go and get a 3rd shot. So if you fit into those categories of being moderately or severely immunocompromised, we don't recommend that you check antibodies at this point in time, because we're really not sure what those numbers mean and are they the right antibodies to measure. And we really recommend that all of those people in that moderately to severely immunocompromised group get a 3rd shot. In the future, we'll probably recommend that they get it at day 28 after the 2nd shot. So in the future, what I would be telling somebody who came to me today is, if they've never been vaccinated before and they fall into this moderate to severe immunocompromised condition, get a vaccine today, get it in about a month, and then get another dose, a 3rd dose, in about 2 months. That's a different idea than a, quote, booster. A booster shot we give to somebody who mounted a good immune response after their initial series of vaccinations, but then over time it wanes. Their immunity wanes. Now, we don't know at this point in time, does that mean that their clinical immunity has waned? Certainly, from the data that we have available right now, just published in the MMWR, the Morbidity Mortality Weekly Report, for the New York City and New York State experience for May, June, and July, the vaccines did not diminish their efficacy in terms of serious illness. So that's critically important to understand. And the question will be, and a lot of this is based upon the data from Eretz Yisrael, from Israel, where they did show that giving a third dose seems to provide benefit to older people. I'm not going to begin to define older, but I think it's safe to say that in their studies, they didn't really start seeing any serious illness until you started to hit 50, very little serious illness, 60, a little bit more. And when you started to hit 70 and then 80, a little bit more. Most of the people in those age groups still were tremendously protected from serious illness. So therefore, I think at this point in time that a recommendation will ultimately be made, but I'm not even sure of that people above a certain age and beyond a certain point in time, probably 6 months, will be advocated to get a third dose. But at the present time, that's conjecture. It is not, enough science yet to say that that will be the answer. I think it's a reasonable expectation based upon the Israeli experience and what we know from the laboratory. It probably is going to come at some point in time, but at this juncture today, people are just viewing this later on. I'm talking on September 1st, 2021. So if you're going to view this, at a different point in time, it's important to know the date. At this point in time, I think it's a reasonable expectation that people who are 6 months or more out from their second dose of the vaccine, and if they're above a certain age, and certainly if they have the moderate to severe immunocompromise, because they'd make it on that alone, those people should be considering a booster.
Okay, thank you. Let me pose another question to you. We had a question about breakthrough cases that I know we've been hearing about. And this question specifically focused on asking if there's truth to pregnant women being sicker and vaccinated than someone who's not vaccinated and pregnant.
So if I understand the question about the pregnancy, let me restate it just to make sure I understand it. Are you asking, do pregnant women have a worse reaction to the vaccine than non-pregnant women? So the answer to that is no. They have the same reaction. The pregnancy doesn't make your reaction better or worse.
Okay.
And do they respond to it? Yeah, they respond to it tremendously. Pregnancy is not an immunocompromising condition that will make you respond less well to the vaccine. And absolutely, it will prevent you from getting sick with COVID. And that will potentially kill, and certainly make the pregnancy that much more difficult if a pregnant woman gets COVID.
Okay, let me follow up with that. I think the question, I didn't articulate it well, but is if she was vaccinated, would a breakthrough case, would she be sicker in a breakthrough situation?
Okay, good. So the breakthroughs that we're seeing in vaccinated people are real. It's not something to ignore, but at the same time, you have to put it in perspective. Most of those breakthroughs are mild. Some of them are even asymptomatic that are identified through screening tests, or people going on an airplane and getting tested, or people being exposed and getting tested, but they're asymptomatic. And that's the majority of vaccinated people have that type of a breakthrough. And as I mentioned, from the Israel experience, as you get older by decade, you start seeing a little bit more severe infection. So yes, breakthroughs occur. It's a relatively small number still, but those people are contagious, and those people, in fact, can transmit. And therefore, when you are vaccinated and been exposed to somebody, you should take precautions. You actually do not need to be in quarantine, but I recommend that those people be very cautious and wear masks when they're around anybody else indoors other than their immediate family, and that they should get a PCR test 3 to 5 days after the exposure, and that they should be self-assessing themselves every day for 14 days for any symptoms, a cold, that's symptoms. Loss of taste, loss of smell, those are symptoms. And then they definitely need to get a PCR test because they probably do have a mild case of COVID.
Thank you. I think that answers the question. We're seeing a few questions related to schools and school policies. And I think hoping your opinion that you could lend your opinion to people's concerns about barriers being taken down in schools, class sizes being increased from what they were last year, and that knowing in some schools there may not be as much mask wearing. Do you have an opinion on the plexiglass and barriers being removed?
Sure. So I think that we never really had data to support the use of plexiglass and other mechanisms of barriers. They make sense, but there are really limited data suggesting that they're beneficial. And if can you really enclose somebody in a bubble? I'm not sure that that's really true. So I have never been a major proponent of barriers like that, because the air goes above them, people stand up, people go around them. They're not really full barriers. They may or may not have some benefit. There are some studies or some limited studies suggest that people rely upon them and then do activities. I think one of the reasons why we're seeing the breakthroughs in vaccines is people are no longer being careful. People that are vaccinated think they're Superman, Superwoman. Now that's not true. And while people alleged that the vaccines would impact your DNA and have all sorts of weird impact on your DNA, which is absolutely false as well, it also doesn't impact your DNA to make you Superman. So people still need to be somewhat careful, even if you're vaccinated. And that's why some people, especially if you're older, and especially if you're in a crowded, small room, and especially if you're with a lot of people that you don't know, should still be masking indoors. CDC says consider masking under all circumstances indoors when you're in a large crowd, especially if it's in a small room. So I personally mask in my shul when I'm in certain smaller minyanim, but I don't mask when I'm in larger minyanim. And depending where I sit, if I sit up front and nobody's near me, then I don't wear a mask. If I sit in the audience listening to one of the other rabbanim in the shul give a shir, then if I'm sitting near other people, I would consider putting on a mask. So that's what I call intelligently using layered strategies to go and decide what's appropriate. I can't say always wear a mask, but I can't say never wear a mask if you're vaccinated. I think intelligence, common sense needs to be applied because we just don't know all of the answers. And that would be the best answer I give to somebody about the barriers. Now, in an ideal situation, if you're dealing with children above the age of 12, I do think that they should be masking if there are children in that room that are unvaccinated. If everybody in that room is vaccinated, then that's a different decision point. But again, you have to follow Department of Health regulations. So whatever may or may not be reasonable risks to take, if the Department of Health says this is our guidelines, then you have to follow the guidelines. Again, if they're against Jewish law, and none of these are, we can have a discussion about ignoring public health guidelines. But when they're in accord with Jewish law in terms of protecting ourselves, so then each individual school, yeshiva, with its rabbanim listening to the medical advice and following the guidelines, has to come up with policies that are reasonable. They're not going to be perfect. A perfect policy, which none of us want, and I certainly have never advocated, is that every child should be at home alone by themselves in front of a Zoom and learn for the rest of their lives. That is safe, but foolish. That is safe from COVID, horrible for mental health, horrible for spiritual growth. So we don't recommend that. But to just throw every kid into a school and say, go like it was 2018 and do everything that you did then is also foolish and dangerous, and I think breaches Jewish law. You have to take appropriate precautions, layered strategy.
Thank you. Could you address the question of if you've, in your experience, more children are getting COVID?
So the answer to that is absolutely clear. We are seeing more pediatric hospitalizations than we ever did before. It is proven that Delta is much more contagious and that it spreads in children. So absolutely, yes, we're seeing more children impacted and infected seriously. Again, Baruch Hashem, thank God, a small amount, but more. You know, if it's your kid in the ICU, that's not much of a consolation to say that most kids aren't in the ICU. So any child in the ICU that could have been prevented is a tragic situation if it happens. And yes, we're seeing many more young adults. The 30 to 39 age group is the fastest rising admitted to the hospital population. Now, that group tends to be unvaccinated compared to the 70 to 80-year-old group. In the senior citizen populations, you have vaccination rates of 80, 90% because they know how serious COVID would be if they got it. But the 30 to 39-year-olds, they tend to say, if I get COVID, I'll do fine. That's incorrect. Not all of them do fine. Some of them have acute illness. Some of them don't have acute illness, but they have long COVID, the COVID haulers. Not fun. I know people that have not regained their sense of taste and smell. To go through life without taste or smell, not a pleasure, not a fun thing to do. And if you could have gotten vaccinated to prevent that, instead of seeking out all sorts of treatments and all sorts of experimental trials to get your taste and smell back. So these are concerns. And again, the choice is vaccination, which is extremely simple and extremely safe. And to put that in the risk of getting COVID, I don't understand it from a medical or halachic point of view.
Someone did ask a question regarding having had COVID and loss of taste and smell. Are there anything to do to help bring that back?
So the number one thing that we should always do in that situation is daven. And I don't say that lightly. We sometimes tend to give that short shrift. It's only if the medications don't work, then we daven. So I say that with all seriousness. Daven is the answer. Now, in many medical situations, it's daven and take the medical care. Here, it's just daven. There is no effective therapy to, as far as I know, to go and regain the loss of taste or the loss of smell due to COVID. Now, Baruch Hashem, most of the time it comes back on its own. Thank God, it will hopefully return on its own. But I do know a significant number of people where it hasn't. And other long-term COVID complications. We don't know the full impact. The brain fog, the inflammation of the heart that can occur from COVID, the impact on other parts of the body. Those are long-term real consequences, not theoretical, what's going to happen with an mRNA vaccine 20 years from now. These are people that have illness 6, 8, 10, 12 months after COVID. Is it ever going to go away? Will it get worse? I don't want to scare people, but we have no idea what long COVID will turn into. That concerns me tremendously. And I would do anything in my power to prevent getting COVID so I don't have to think about what long-term COVID might mean. And again, that occurs in young people, it occurs in children. This is a real medical problem, as opposed to some of the theoretical concerns that people always love to tout, which are legitimate concerns, but that's all they are, theoretical, unproven, and highly unlikely based upon everything that we know.
Thank you.
I don't want to cut you off, but maybe we can just ask one or two more questions because I do have another appointment in a few moments.
I was just about to say the same. I think, well, one other question I was going to pose to you was someone asking, I know you talked a lot about mask wearing and you shared your own personal view on it. A grandparent whose young child is in school and too young for a vaccine, do you recommend wearing a mask around their grandchild if they themselves are vaccinated?
So this is the million-dollar question, and I get this. I get this asked multiple times every day. I was actually typing out an answer to this at 7:58 today. So it is a personal decision. I can only give everybody the relative risk, but they always ask me, well, what would you do? I sometimes will tell them what I'll do, but that doesn't mean that what I do is right for you. So the answer to these types of questions is depends how much risk you're willing to take. There is absolutely tremendous benefit from the vaccines. And when I got doubly vaccinated, I did hug my grandchildren for the first time in a long time. And that was one of the best days of my life. I hug my grandchildren today, even though they go to school and they don't wear masks all the time. And they're young children, and some of them are under 2, and they can't wear a mask. It's contraindicated to get these children a mask. But I've made the personal decision that since I'm fully vaccinated, that I'm willing to go and take that small risk. Now, another person who may look like me, but they had a organ transplant, well, maybe they shouldn't be taking that risk. I recommend that they not take that risk. Another person who's 80 years old but healthy, and say, well, listen, you're at a little bit higher risk than me, but you're less of a risk maybe than the organ transplant patient. I can't quantify that. I can't tell you, well, you have a X chance and therefore yes or no. It's a risk. You have to decide. Now, it doesn't mean you love your children less or more if you do, but each person is different. How much risk will you take? And that's not a yes or no answer. It's a decision you have to decide on. If you're going to make that decision and it's reasonable, that's fine. If you're going to choose to wear a mask, that's fine. It's a personal decision, and it should be guided by your age, your underlying medical conditions, your vaccination status. Obviously, if you're not vaccinated, absolutely you must wear a mask, in my opinion, because it's just putting yourself in harm's way. And there are other factors as well. And if you have doubts, you should discuss it with your doctor. And that hopefully can keep everybody, your children and you, grandchildren and you, as safe as is humanly possible. So I thank you so much again for putting on this program. I wish everybody, most importantly, a Kesiva v'chasima tova, a happy and healthy, sweet new year. It should be a healthy year. It should be a year that we can talk about this pandemic in the past tense. And when we go to shul on Rosh Hashanah, we should all daven for all of the health of Klal Yisrael, not only our own personal health. And hopefully God will listen to our prayers and answer them in a way that we don't have to ask even about masks for Yom Kippur. So thank you very, very much for hosting this program.
I thank you so much. Before we close, someone asked a question about the JCC's policies. And I just wanted to say that while we're not addressing that here, of course, you're welcome to be in touch with the school or the JCC offices so we can answer any questions you have. And I also want to thank Rabbi Dr. Glatt again. And you mentioned Kathy Byrne, and I also wanted to thank Kathy, our Associate Executive Director for Older Adults and Special Needs, who worked really behind the scenes to get tonight's program going, and also Chani Adler, who is our tech guru. So we thank you as well. And looking forward to seeing people at future programs, and wishing everybody a Lashana Tova.